Following on from your effective primary survey, if we discover the casualty is not breathing or not breathing normally, we need to start acting very fast indeed. Primarily, we need to make sure an ambulance has been called and the information has been given to the ambulance service that we now know that this person is unconscious and they're not breathing. So once we've established the casualty is not breathing and an ambulance has been called, we need to get them onto a hard surface, onto their back. So if they're in a chair, in a bed, or any other unsuitable surface, they need to be placed upon the floor. We're going to need to get access to their chest. So if they're wearing a big winter coat, a scarf, or any other workplace PPE, then we're going to need to remove it. Chest compressions is where we start. So the heel of the hand needs to be placed directly in the centre of the chest. Normally that would be using 2 hands upon an adult. We're going to keep our arms nice and locked and we're going to press down 5 to 6 centimetres, giving the greatest depth possible. Once we've completed 30 chest compressions at a rate around about 2 per second, this will give us then the optimum compression rate of about 100 to 120 compressions in a minute. Once we've done our 30 chest compressions, we're then going to carry out 2 breaths. Now remember, you can elect not to provide the breaths if you are unwilling or unable to provide rescue breaths, then that is absolutely fine. And you just carry out your continuous chest compressions. Obviously, the casualty does need oxygen and it'd be more beneficial for them to receive it. So at this point, give them a head tilt chin lift, pinch the nose and provide the 2 breaths. We're only going to try twice. If the first one fails, we go on to breath number 2. If the second one fails, we go straight back to 30 chest compressions and we continue at our ratio of 30 to 2. We may want to stop upon the event of swapping over with another first aider. Ideally, we would recommend that we do that at least once a minute. That way, it stops you from becoming fatigued and the quality of the care that you're offering the casualty remains at the highest level possible. Further to that, if the casualty starts to respond, open their eyes, starts to breathe normally, starts to talk back to you, quite obviously we'd stop CPR. If the situation becomes dangerous, you can't move the casualty, and your life is essentially in danger, then you would need to remove yourself from that situation. The most obvious and the most common though is that when the emergency services arrive, you provide the information, okay, and then they may ask you to step aside, and they'll then continue with the effort to save this individual's life.